for joining us. If you guys were here yesterday, we started our first Live and Learn event, and it was so much fun. We got to talk to you guys about all of our updates that we're doing, membership benefits. If you missed that episode, just check us out it's on our page, it's on our Facebook and our Instagram. And today, Dr. Kash is going to be talking about how to stay healthy at home, and he's also going to be talking about new services offered. So I will let him take over.
All right. I think we're on, not muted yet. I'm Dr. Kash. How are you? Medical Director for Novuskin. And I wanted to just touch base a little bit on COVID. I know there's a lot of information out there, a lot of people freaking out. But there are some good practices you can take at home and just some mindfulness. Now, as we know, there is no vaccine currently, okay? So really the most important thing is preventing exposure, okay? And that's what we're doing right now, okay? We're preventing exposure by social distancing, wearing these masks. One day the CDC says wear them, one day they don't wear them. But overall, to be safe, I would have a mask on you. Washing the hands, I think the most important thing, and touching your face, okay? Washing the hands, hand sanitizers, all those things should be kept around at all times, okay? Washing the hands means a good 20 seconds with soap, okay? Hand sanitizers must have at least 60% alcohol, okay? And then just try not to touch your face. This virus is spread through the respiratory system, okay? We're doing the distancing, that's really important. I think the consensus is if you're sick, wear the mask, okay? And we're walking around seeing everybody with masks. I don't think it's necessarily, it's a must, but if you're definitely sick and you don't know what it is, wear your mask and stay at home, okay? The disinfectants they're using at home, okay? Those are really important. I know the virus, you've been told the virus stays on any surface for a couple of weeks, and that's true. So, the cheapest way to really kill the virus is with like 5 tablespoons of bleach and a gallon of water, okay? That basically eliminates most of the bacteria and the viruses, okay? And then really what we got to do right now for next month, 2, I don't know how long this thing will last, but really stay informed and watch for symptoms, okay? And the symptoms, I think everyone knows for the most part, it's respiratory. Fevers could be a part of them, headaches, muscle aches, a lot of those just weird things. Just monitor yourself at all times, okay? And right now I know stress is very high right now in the whole world, okay? And stress and immune system are related. The more stressed you are, the more your immune system has to fight. And in some ways, for a lot of people, they have a reduced immune system because of all the stress. Now we're stressed because financially, we're stressed because we're stuck at home. We're stressed because of the unknown. So all these things are bumping up our cortisols, and our cortisol is our stress hormone, okay? And too much cortisol for a period of time is not very good for you, okay? So I'm gonna be telling you guys some ways to minimize cortisol. It's hard to say, just don't stress because it's very hard not to stress during these times.
And I just want to add, if anybody has any questions, go ahead and leave them in the comments, and we'll respond to those.
Right. There's all kinds of material online. I won't get into those, but deep breathing, meditation, eating healthy, exercising, sleep is so underrated. You guys should be sleeping. If you have to use any sort of sleep aids, keep them natural, melatonin, 5-HTP.
Try to sleep the whole time, right?
Try to sleep, yes. And then obviously, right now I know alcohol and drug consumption has increased, but those obviously are huge markers for ultimate stress and reduced sleep and reduced immune system, okay? My main point today was tied around the service we're going to bring. And the service we're going to bring is going to be immune boosters, right? The immune boosters is going to be an IV cocktail. It's related to a Meyer cocktail that was formulated by Dr. Myers like 50 years ago. And right now, since all we could do is literally limit exposure or boost up your immune system, that's all there is left to do. Okay, there's no vaccine, there's no treatment at the current moment. Okay, so in a sense, we're all at risk. Okay, and one of the things we can do, aside from all those things that I mentioned, exercise, sleep, all those things, is take this immune booster, IV infusion. Okay. I'm going to touch base on some of the things that have, as a long list of items that you can consume to improve your immune system. Okay. There's zinc, selenium, iron, copper, folic acid, vitamin A, B6, C, E, D, garlic, astragalus, milk thistle, ginseng, green tea, cumin, licorice, elderberry, mushrooms, acai berry, oysters, watermelon.
Licorice, like the candy?
Licorice, that's right. And then obviously, not smoking, okay? Nicotine is known to weaken the immune system. Okay? So what we're going to offer here at Novuskin is basically infusions. And I know that the spa at the moment is closed, so I think we'll have home services as well. Is a formulation of the Maya cocktail, which is basically a bunch of IV vitamins. It can be given with an IV bag or as a quick push over 5 minutes. Okay, and all it is a mega dose of vitamin C, and I want to say about 20 or 30 times the daily value. Okay, a bunch of vitamin Bs, and then a bunch of trace minerals. Okay, and this has been shown in many cases, treating all kinds of conditions. They've treated asthma with this, migraines, chronic fatigue, fibromyalgia, depression, hypothyroidism, allergies, narcotic withdrawals, and most importantly, upper respiratory infections. Okay, vitamin C has been a long sort of component of immune defense, and it seems that they're using it more and more now to boost the immune system and fight against mostly bacteria and viral infections. Okay, is that pretty clear?
Yes.
The vitamin C cocktail that is in any of these cocktails, it has to be high dose. It has to be about 20 to 30,000 milligrams, and that's basically diluted in water. So but when given intravenously, it really makes a lot of magic happen. They're starting to use this in I believe China. They've been using it in some of the hospitals in US for people that are currently on with COVID, and it's been showing that it's reducing the hospitalizations, and it's making them recover faster. Okay, about 50% faster. So it must be doing something. But remember, it's at a high mega dose. Okay, and that service will provide to you, I believe, our members and non-members.
So how long does it last?
Yeah. So the question that I always get is, how long does it last? I would say, about a week is where the vitamins will be circulating in your system. Okay, you get flushed in really quick. You feel a little bit warm. You feel sometimes a little dizzy, but this huge influx of vitamins, kind of tops off your levels, and then you probably, if you have extra, you pee out the rest. Okay, it's not toxic like the fat soluble vitamins, A, D, E, and K. We don't really have much of that in there, but you top it off, and I think about a week. I would recommend weekly infusions until all this outbreak and scare is over.
So we had a question come in, and they wanted to know how much it costs.
Yeah, the cost will be discussed on the website. I don't even know the cost at this point.
Okay.
But I think we'll be sending out a flyer or brochure or emails, I believe, discussing cost. Okay.
We'll get that figured out by today. And if anyone has any questions, they can give us a call. Give customer service a call.
Yes. Is there any questions anybody has?
Let me scroll up and see if there were any previous ones.
Okay, some people joined. Hi, everybody. Joycey, Melina. Hi there. Thank you for joining. right. Red hot candy. Okay, so
we can talk about some other things
if
we
yeah.
don't have any questions about this. Does anyone have any questions about injectables? Or...
Yes. So we're all excited to get back to the injectables
yes.
and looking good again when this quarantine is over. And I believe we'll do that hopefully the next month or two. And I believe we'll have some nice promotions for you guys after all this is over. I know a lot of us are going to be needing a lot of services here.
Me.
So I'm really excited about it. Just get through this part. I think most important thing is staying healthy, you know, and doing all the things that CDC and the government tells you to do, you know. It's better to be safe than sorry is what I say, you know. I know you don't see a lot of people, it's not like New York City right here, but I think that it's just ramping up. It's gonna get bad. I don't know, worse obviously in the next couple of weeks. I just don't know how bad. No one can really estimate, but just do the steps that you can do in order to do your part, okay? Which is, you know, following those distancing and staying at home. You know, if you're sick, wear the mask, don't go anywhere, boost your immune system, take care of the elderly, children, okay?
And we have a question that came in, and they want to know, how does vitamin C differentiate when with you versus other providers?
How does vitamin C?
It's on this one.
How does that vitamin C?
So I think, how does our cocktail differ from other people's?
Okay,
that
so
other people are offering?
So vitamin C, the raw compound is bought by compounding pharmacies. So I believe it's a powder they buy in chugs of kilograms and pounds. Okay, it's isolated vitamin C. These compounding pharmacies, they basically take this and then they make a sort of an injectable form of it, which they add some preservatives, but very minimal. And it's usually a little bit of benzyl alcohol just to make things sterile. And most of these compounding pharmacies, they're, you know, a lot of them are in town, some of them are out of town, but they're all basically the same format, okay? It's ascorbic acid injectable. All these clinics you see around that are using vitamin C, they basically buy the same vitamins. It's a 50 or 100 cc sort of vial, and then they mix it up however way they want to, okay? But basically, wherever you go, ascorbic acid is from, you know, raw material that compounding pharmacies create in order to sell to IV clinics or spas or whatnot, and then we administer them, okay? Based on the formula that we like or some standard formula like the Meyer cocktail, okay?
So we had a question come in that says, yes, I really want to come check you guys out. I wanted the facial, but they told me I couldn't because of my braces. The reason you can't use most of our treatments is because we use radio frequency, and radio frequency, you're not supposed to have any metal in your body. So that's why you can't come in because of your braces. But you can always come in and get some injectables by Dr. Kash, or even get the immune booster too.
Right. Now, we're not quite sure if the spa is going to be open anytime soon. I know this immune booster is considered an essential service. I can't imagine it not being, but that's kind of a variable factor. But I believe we will have home services where we'll send staff to do these vitamins. Okay, and perhaps we're thinking about adding some COVID testing, some in-home testing as well, but that's yet to be determined. Okay.
Do we have any other questions? Yes.
Any questions, anybody? Hi, Melina. All right. We're currently on Instagram and Facebook.
We're currently on Instagram and Facebook, yeah.
Okay.
And of course, we're gonna save all of this stuff too and repost it. So if you guys want to rewatch, you can do that. So we'll give you guys another couple. Let's do someone wrote something. Thank you.
Okay, no problem, Red Hot Candy. So I'll tell you my personal experience with the vitamin drips. The vitamin drips, I started to do on myself, I want to say about 2 years ago. And I remember the times that I was taking it routinely every week, I don't think I ever got sick. So not even a cold. So I do know it works. I've tried it on various kind of patients with things like acute headache, asthma, and there's minerals like magnesium, for example, that basically stops bronchospasms. So it improves someone has with asthma attack, migraine. Migraines I've seen it work really well. Someone with an acute headache and you push the drip and the migraine or headache, whatever kind it was, improves or gets better completely. Okay. I've seen it a lot with energy and people that want to improve their performance. They recover much faster. Athletes do them all the time. It's really improved. It really helps fatigue. And I know right now we're just kind of stuck at home, and because we're not active, we even feel more tired. Okay. So
is it true that you can sleep too much?
Yeah, absolutely.
And does it make you more tired?
In some ways, yes. We need to be active, and the more active we are, the more energy we sort of get. In these stressful times, I think the stress is and the fear, unknown, anxiety, all those things kind of make us feel more depressed, more fatigued, and as a result, a lot of us just kind of staying in bed. There's nothing to do. But there's things you can do. Yes, there's things you can do. Absolutely. There's all kinds of home exercises. There's a lot of things on YouTube. I think P90X, some of those videos are free now. There's tons of material that you can learn. I think take this time to, nourish yourself and help yourself kind of learn new things. And today is the only day you should think about. Tomorrow will come when it comes, but do the best you think for yourself today, as far as taking those steps, making those decisions that will ultimately, add up to, whatever our destiny is, right?
So we have a couple questions on Facebook. Ali wants to know if it's okay to take this Myers injection more than once.
Yes, Ali. I've done it on people on several days in a row. I've done it up to about once a week or two. I recommend at this point once a week. You always top off all your vitamin receptors, and you can do them repetitively if you're depleted in vitamins. If you have a certain diet that you're low in certain vitamins, I think this drip infusion will expose that. So if for whatever reason you've been fatigued or you've had something that you can't find out what it is, a lot of times this push will make you feel better, and then you realize, oh, you had a magnesium deficiency or something, right?
We have another question too. Are you performing only a medical vitamin C or customized vitamin C mixed with gluta, etc., to have a glowing enhancement as well?
That's right. So let me see that again. All right, yes. So the vitamin C is going to be customized. Obviously, we'll infuse less into a smaller person or a kid, and more to someone that's 200 pounds and above, right? So the rough range is, I would say, between 5,000 milligrams to about 30,000 milligrams. Okay.
What is it infused with?
Yes, and then the glutathione I always have with me. I believe it's a little extra charge, but I firmly believe in glutathione. It's a great, the most powerful antioxidant in the body. It helps basically in every single cell. It helps recovery. It helps immune system. And I'm recommending this along with vitamin C in the regular cocktail all the time, really. Okay, and it's been shown to brighten skin and you know, be anti-aging. So it's a little extra charge, but I think it's worth it. I'll have it on me at all times. We have tons of it at the spa, and please ask for it if you want that, okay?
Any other questions, you guys?
Let me see.
Did I miss anything? And then I just wanted to say to Candy too, when your braces come off, please come in. We will keep that facial ready for you.
Yes.
We'll give you guys some more time.
Any more questions?
So we also hope that you guys are enjoying the Live and Learn events. We want to keep them rolling. If you guys even have any suggestions on what you'd like to learn about, please put it in the comments, because
Absolutely.
yeah, we want to see what you're interested in hearing about. So definitely leave that for us in the comments. Next week on Monday, I'm very excited to announce that we're going to be having a new dermatologist join our team. Her name is Dr. King. She is such an amazing woman. She's won so many awards. She's been on so many magazines. So I'm very excited to bring her into our team. So she's going to be on Monday, same time, starting at 11, and we are going to be talking about acne and rosacea. So I don't know if anyone else has been dealing with some acne during this stressful time, but like me. So we're going to get into that. And if you guys have any questions for her, think of them now, put them in our comments, get ready for them to talk to her about that on Monday, because she's going to be happy to answer any of your guys' questions. And Anna, I'm sure most of you guys already know Anna as well. She's also going to be joining us on Monday too. So we're very excited to see you guys on Monday. We're going to just give you a couple more minutes. Is that a question right there? I can't wait.
I want to come check out the cocktail.
Amazing.
All right, we'll see you here.
We'll see you here
Or
then.
see you at your house, okay?
All right, and I think that's it for today. Thank you so much for joining us.
Yes.
It was good. I hope you guys all learned a lot, and we will see you again on Monday. Take care, you guys.